Alright. Hello, my name is Ansley and I'm going to be your student nurse today. I'm going to be performing an assessment just to make sure that everything is going well, that you don't have any changes from your recent clinical findings. Can you tell me your name and date of birth while I do my hand hygiene just to make sure we don't spread any germs?
Sure, I'm Maggie Anderson, and my birthday is May the 14th, 1999.
Awesome, and I'm looking at your hand, or your wristband, and it looks just the same. Can you tell me why you're here today and where you are and what the date is?
Yeah, so I'm at the hospital today, and it's June the 30th, 2020.
Okay, perfect. And do you know what day of the week it is?
Today's Tuesday.
Awesome. So she is alert and oriented ×3. She knows person, place, time. Can you tell me how you're feeling today, Maggie?
I'm feeling pretty good. I don't have any pain today, so that's good.
Okay, awesome. And I have her sitting in a chair today so that she's real nice and comfortable with a pillow behind her back so that she is supported. So the first thing that we're going to do today is we're going to test her reflexes. So I don't have a hammer with me today, but I would in practice. So I'm going to test her bicep reflex by holding my thumb here and striking with the hammer, and then her tricep by holding her arm here and striking with the hammer, and then I would do her popliteal by holding here, striking with the hammer, and then do her Achilles and strike with the hammer in the back. So all of those were good. She did not seem to have any hyper reflexibility, and they were equal bilaterally. So next I'm going to stroke her foot and do the Babinski reflex, and her toes should fan. So stroke, yes, good, perfect Babinski reflex. And I'm now going to assess her head and her jaw. So I'm just going to make sure there's no areas of bruising. Does anything hurt when I touch?
No.
And I'm going to feel her jaw. Feels nice and intact. I don't feel any areas of any lesions or any asymmetry, so her head feels nice and symmetrical. So can you just smile, raise your eyebrows for me? Awesome. So I'm just checking your neurological nerve status, and those were perfect, equal bilaterally. Now can you squeeze my hands? Awesome. Can you raise your hands up against mine? Perfect. And then can you push against my hands? Perfect. So all of her strength was very equal, and her ocular movement was great. So originally we would be doing a visual acuity test, but today I do not have a Schnellen chart with me. And how I would perform that test would be to have her stand 20 feet away from a Schnellen chart that is placed on the wall. And I would have her wear her glasses if she wears them, or contacts, and then also do a test with them removed. I would ask her to read the line of letters that she can read the best, and I would have her to read them back to me with her right eye covered and her left eye covered, and with both eyes open. I would be able to just see if she was 20/20, 20/40, whatever the ending goal would be. Do you wear glasses?
I don't.
You don't? Okay, so you don't have any trouble seeing.
Mm-mm.
So that's great. So now I'm going to do an exam on her eyes to do just a check on her neurostatus. So this is just a bright light. If you would just look at me. Perfect. Perfect. Now can you follow my pen light with your eyes?
Sure.
Awesome. Great. So her eyes had great ocular movement. They were equal, round, reactive to light, and accommodation. So now I'm going to inspect her ears. So I just have my pen light. I'm just going to go up and back, and I don't see any abrasions or bruising. Can I look at the other side? Awesome. I don't see any excess wax. And do you have any trouble with your ears or hearing?
Mm-mm.
No? Okay. Perfect. Now I'm going to do a little bit of a hearing test. So I'm going to go stand behind Maggie, And you just tell me which ear you hear things from. So I'm just going to snap my fingers and you just tell me. Perfect. Perfect. So did you hear those equally?
Mhm.
Okay, great. Do you wear any sort of hearing aids?
I don't have any trouble with my hearing. Typically.
Okay, wonderful. So your hearing is great and your eye movement is great. So the next sense that we're going to test is her sense of smell. So to do that, I'm going to have you close your eyes, Maggie, and see what we have here, and you're going to tell me what you smell.
Okay. Ooh, pepper.
Perfect. So
yay.
yes, this is pepper. So we know your sense of smell is intact and you don't have any problems with that area normally, do you?
No.
And you taste things great?
Yep.
Awesome. Okay, so now I'm just going to look in your mouth and visualize your tongue and your teeth, back of your throat. Perfect. Awesome. So your throat looks not red, doesn't look like you have any irritation there. Your tongue is midline, and I didn't see any decay in your teeth and no breakage, which is all normal findings. And so now, can I just have you swallow? I'm just going to put my plant hands here. Can you swallow? Awesome. So I didn't feel her thyroid gland poking out, so that means that she is having no problems with that, and that is a normal finding. Now I'm just going to feel the rest of your neck and just see if I feel any lymph nodes. Awesome, I don't feel any lymph nodes, and then I'm just going to feel her pulse. Great, it's nice and strong, both sides. Perfect, they're equal. And I don't see any jugular vein distension, everything looks great. Awesome. Now I'm just going to ask you to do a few little muscle exercises. So can you show your shoulders? Awesome, against resistance, and now turn your head this way. Perfect. And turn your head this way. Perfect. Okay, can you show me how you move your arms and legs? Like lift them up over your head and then move. Awesome. Legs up and down. Great. Awesome. So she has full range of motion in all of her extremities, which is awesome. Do you have any pain with any of those movements?
No.
And when you're sitting or sleeping?
Nope.
Awesome. Okay, so I've done the majority of all of her neuro assessment. Now I'm just going to continue on to her cardiovascular assessment. So the first thing I'm going to do, I've already checked her carotid pulses, they're +2, and I have checked her jugular vein, and it is not distended. So now I'm going to check her heart rate. I'm going to look with my watch here, and I'm going to count it for 30 seconds to a minute. Perfect. So her heart rate was 65, and the normal is 60 to 100, so she falls in that normal range. She's an athlete, so her heart rate might run a little bit lower. The next thing I'm going to do is just listen to her heart, making sure that I check all of her different sounds to make sure there's no murmurs or swishing. So I'm just going to lift under your shirt. Might be a little cold. Just go under. Awesome. So I heard normal S1 and S2 sounds in all locations and didn't hear any murmurs or swishing, which is great and normal. So now I'm going to check all of her pulses and all of her extremities to make sure that she's having good perfusion bilaterally. Great. Awesome. Now I'm going to check her femoral pulse, which is just right here. Awesome. Popliteal. Wonderful. Okay, now I'm going to check this tibialis pulse. Good. Dorsalis pedis. Great. So all of her pulses are equal bilaterally. They feel like they're +2 pulses. She does not have any decreased perfusion to any of her extremities, which is great. So now I would check her temperature, which I do not have a temperature probe with me today, but I would check oral, temporal, axillary, with whatever kind of probe that I have available. And the normal range for that would be 98.6. So her skin does feel warm, intact, dry. She does not feel feverish, so I would say she's afebrile, probably has a temperature around 98.6. As I was checking out her pulses, I did notice that there was no edema in her legs, around her socks and ankles, and she doesn't have any anywhere else around her body. So now I'm going to take her blood pressure. You just grab my blood pressure cup right here. So the normal blood pressure is anywhere below 120/80. So we're just going to take it and make sure that she does not have any cause for hypertension. Thank you. So you just relax your arm for me, please. So her blood pressure was about 110/75, so her blood pressure is really great. She doesn't need to be worrying about having any sort of hypertension, so just keep up eating healthy foods and drinking enough water, and you should be doing great with your exercise as well. So I'm now just going to watch you breathe. If you would just sit there, be still, and I'll watch you for about 30 seconds to make sure that your breathing is non-laborious. Okay, so her respiratory rate is about 16 breaths per minute, which is very normal, as the normal range is about 12 to 20-ish. So she is doing great breathing, and I did not see any labored breathing in you. You didn't seem to be using any accessory muscles, grunting, or any of the abnormals. Now, do you have any trouble breathing on a normal basis?
No, not typically.
Okay, that's great. I'm just going to listen to you now. Actually, first, I'm just going to feel if you would just take a big, deep breath in. Awesome. So she has equal lung expansion. I didn't feel any irregularity on either side, so that was very symmetrical. So now I'm just going to listen to your lungs. If you would just breathe in each time that I place my stethoscope on your chest. Just going to go under your shirt. Awesome. Now I'm going to go listen around the back of her, underneath her shirt. Breathe in. Good. Good. Great. So her lung sounds were clear. I did not hear any abnormal, of course, wheezing or any sort of crackles. All of your lungs sounded clear, no excess wetness to be found there. You said you don't have any trouble breathing. Do you have a cough right now?
No cough or no extra secretions or anything like that.
Okay, that's great. We don't want you to be having a cough with all of this crazy stuff going on right now. Do you have any? You don't have any labored breathing, so that's good.
Nope.
So we are clear in all lung fields. So your lungs sound wonderful. Now I'm just going to ask you a few questions about going to the restroom and
Sure.
stuff. So when was the last time you had a bowel movement?
I think last night.
Okay. Can you just describe that? How often do you go? What does it look like?
Yeah, so my bowel movements are typically brown, soft, and round, typically.
Okay, and how often do you go?
Probably like every day to every other day. Just
Okay.
kind of depends.
Very normal. So all of those findings are normal. We would like for her to go every day to every other day. So I'm glad you feel that. Do you ever have any bloating or feeling like you're gonna?
No, I don't usually have any kind of digestive problems.
Okay, so I'm just gonna listen to your belly real fast.
Sure.
Great. So she has bowel sounds heard in all four quadrants, and they seemed active, not hyperactive or hypoactive. So that's very normal. We want to make sure that we don't have overactive or underactive bowels. So also, do you have any trouble going to the bathroom, urinating?
Not usually.
Okay. What is usually the color of your urine?
So usually my urine's about like pale yellow, and I go like 5 or 6 times during the day.
Okay. Do you go at night at all?
Not at all.
Okay, that's great. So we want your urine to stay pale yellow to clearish. As long as you're keeping enough water, you should be doing just great. Now I'm just going to feel your belly and tell me if you just feel any discomfort or tenderness. Does that feel okay?
Yeah.
Okay.
No pain.
Awesome. Perfect. So I have actually been visualizing your skin everywhere as we've been assessing, and all of your skin looks warm, dry, intact. I don't see any bruises or lesions. Do you have any bruises or lesions?
No.
Okay, great. So we don't have any incisions to look at, no dressings or drainage to change. You do have elastic skin turgor, very well hydrated, so we don't have to worry about that.
Oh yeah, I pee a lot during the day typically.
That's good. I'm just gonna look
Very
at your
hydrated.
hair. Your hair looks very healthy and shiny, and your nails seem very strong, not brittle. I'm just gonna check your capillary refill real fast on your fingers and this hand. Great, it's less than 2 seconds. I'm just gonna check on your toe real fast. Awesome. So her capillary refill is really great, meaning that she just has some great perfusion to her fingers and her toes. Skin looks pink, your mucous membranes look pink, and your sensation, I know I've touched your fingers and I've touched your feet. Do you have any trouble feeling anything in the mornings or any time?
Mm-hmm.
Okay, great. So your sensation feels awesome, and your voice sounds great. So I feel like you're doing well overall. So do you have any questions for me?
I don't think so.
Awesome. So your assessment looks totally normal. I didn't find any abnormal findings. So thank you for joining me today for our assessment.
You're welcome.
And I hope you have a good rest of your day.